I always like taking care of sick people. Like I knew I wanted to do transplant. I didn't know I wanted to do pediatric transplant until I came to Pittsburgh. So about 12 years ago, I kind of said, well, I'm just going to do kids because it's fun. It's much more fun after the transplant. The transplants are technically much more challenging, and overall the diseases are much more interesting than most of the adult transplants that you do.
My castle. I'm the king of the castle.
Children's is different than any place that I've ever worked at. The number of people here that all have kind of the common goal of the patient in mind. There's, an army of people that I have to help take care of these children. And that is unique to hear.
I'm already a bit nervous. Mm-hmm. It's a type of environment where you could be even more apprehensive because it's like very stark. Everyone's got their gowns on, and it's like real. The reality of it kind of sets in. But then he's in there like he's very at ease. If he's nervous, you can't tell, and it kind of makes everyone much less nervous and more reassured. So
she had a transplant with Dr. Reimer as the anesthesiologist 4 days ago. It was a living-related donor from mom to her. She's actually done very, very well. And a lot of times when you do liver transplants, you can't completely close the abdomen in children initially because there's swelling. And because the blood vessels are so small, you want to kink things off. And so once the abdomen is less swollen, you then go back and you try to close the abdomen. It's not a big surgery, it just kind of is something that's kind of routine maintenance stuff after transplant. She did great. Everything's closed, muscles closed.
Oh, wow.
No future surgery.
Awesome.
Closed very easy. The post-operative ultrasound looks fine. Fluid looked fine in the belly. Everything looked clean. We sent cultures. We followed those up, but I don't think there was nothing in it that was even remotely scary. The ultrasound looks perfect.
Awesome.
So the way we do rounds generally, we sit down as a group and go over the patients, and then we go off and round and really do the detailed rounds here so that we can spend time and just kind of see the patients in an efficient way. The patients are generally seen by one of the mid-levels anyway before I even see them, and so it makes it a lot more efficient to do it this way so that we know everything that's going on before we even go out there.
He's a funny dude. He's a funny dude. I can tell you that from off the bat. There's sometimes he has some flappy hair days, and then there's other days his hair just look good. Because today he looks real good. But as far as the care of my dude Jonathan, he is wonderful. He's funny. He's tried to make us feel good. Make us feel funny. Laughter is good for the soul, and Dr. Sources bring us in when he comes in.
We're going to go see the young girl that we closed her abdomen the other day in the operating room. She's actually been doing well. They took the breathing tube out, as I promised, and she overall looks great.
Hi, gorgeous. To take a child that is really sick, who is in the ICU, dying of their disease, and then to be able to go out, fly somewhere in the country, take a liver, take this gift from another child, bring it back here and do this very large surgery, and then have the recipient, almost instantaneously better. That is really quite rewarding. I follow, 1,000 patients, but we only do 50, transplants or transplant procedures in a year, and so it gives me an opportunity to really get to know the kids, to know the families. Everyone has my phone number. We talk on the phone, they text, they email.
She's just like,
I love you, Dr. Saltis, you're the best. Okay.
And it's a very different feel, and that makes it very rewarding that you can not only know what you're doing to help the child, but to be able to communicate that to the family directly, to be able to kind of hear from the families all the time about how the children are doing. It really makes a huge difference.